When I didn't know that I had a disease, I would drive to work in tears thinking that I was gonna die because I didn't know what was going on with me and I didn't know how to share that. And I had this fear that what if I don't make it back home to my son? Unfortunately, I had been battling symptoms for 25 years. I started actually having symptoms of digestive challenges when I was about 5 or 6 years old. And I would use the bathroom for long periods of time. But it was at 13 years old when I started having rectal bleeding that I really alerted my mom. It alerted her and scared her, and she then made an appointment. She got a referral, and we went to see this gastro. She shared with him the challenges that I had had for years. My daughter's been using the bathroom for long periods of time. She's had some severe stomach aches that causes her to sleep in the bathroom sometimes, cold from the bathtub, soothing her. So she's explaining all of these challenges to the physician, and he's taking it in. And at that point, he says, she's gonna have to have a flex sigmoidoscopy. Once that procedure was done and he looked at the reports, he says, oh, all she has is internal hemorrhoids. So a child that's had debilitating stomach pains, that is causing her to have very frequent bathroom use at times, long time frames of bathroom use, and now internal rectal bleeding is just diagnosed with internal hemorrhoids. So I went through years of carrying Preparation H and Pepto-Bismol and drinking Metamucil to try to manage what I thought were just these internal hemorrhoids that were triggering other challenges with me physically. Even my family knew to carry these over-the-counter drugs. So we were all singing that narrative, and we are educated. We have access to care. We have good health insurance. So the only thing that I can really point the challenges back to was miseducation of a community that was lesser served and racial bias. It took me until I was about 36 years old, where I had had 2 years of stomach aches. I started having bleeding that persisted for 4 months straight. This was the first time it didn't go away. I didn't know what was going on with my body, but to be honest, I thought I had cancer. And that began the course of actually navigating me 2 surgeries later and 35 pounds lost in 6 weeks and loss of mobility and more hair loss and infection in my eye consistently every 3 weeks, to me finally getting diagnosed with Crohn's disease. Inflammatory bowel disease is hard. Crohn's is hard, ulcerative colitis is hard. Anyone who says it isn't hard because they're smiling and they're making choices for joy every day, they're lying. It's hard. And as we manage our mental health with these chronic conditions, we have to know that there are spaces for wellness and joy. I invite people in to know this is a day that I'm having. I'm having a yellow day. I'm having a purple day. I'm having a green day. You know, whatever colors I've connected, so I don't have to explain. They know what these days mean, but I made the choice that even in those days, where is my value? I'm my value, and what can I do to be better? My name is Melody Narain Blackwell, and I'm the founder and president of Color of Crohn's and Chronic Illness.